Obesity. Introduction. Obesity until recently was considered as a cosmetic nuisance, personal issue, and social problem, but now it is realized that it also poses a major health hazard in later years, causing morbid conditions at a times and early death. Now considered as a metabolic disorders, its prevalence has increased globally and threatens the health of the individual. Once acquired, it is difficult to get rid of, despite of dietary control and exercise. Prevalence. Increased prevalence over the previous years is due to several factors. Lifestyle change, better social and economic environment has changed the lifestyle of the people. Overeating and overindulgence in the wrong foods has led to obesity. Lack of exercise due to heavy and prolonged hours at work, physical disability, and sedentary life, causing less utilization of the calories and accumulation of body fat. Genetic. Increased birth weight and maintenance of the increased weight throughout the childhood and adolescence. Definition. Obesity is defined in terms of the body weight over the height. Body mass index is expressed as weight in kgs divided by weight in meter square. Normal BMI is between 18 to 25. Below 18 is considered as underweight. Between 25 to 29.9 is considered as overweight. Between 30 to 35 is obese. BMI over the 35 is considered as morbid obese. Waist to hip ratio should not exceed 0.8. Etiology. Apart from the above factors well known for the gain in weight, obesity is considered as a metabolic disorder originating in the fetus itself, partly contributed by the mother's environment during the pregnancy. Maternal conditions during the pregnancy are overnutrition, glucose intolerance, and diabetes, leading to macrosomic fetus. Metabolic changes in the fetus persist throughout the childhood, adolescence, and adulthood, leading to the overweight and obesity. Other factors are as follows. Genetic. Family history reveals the obesity. Pre-pregnancy weight. Overweight mothers gain more weight than the normal woman during the pregnancy. They also retain the increased weight gain postpartum and put on some extra pounds also following each delivery multipara, therefore tend to be overweight as compared to preemies and those with lesser pregnancies. Menopause, low metabolic rate and inactivity add to the woman's weight after the menopause. Overeating, eating wrong food, lack of exercise, sedentary lifestyle, diseases like thyroid, hypothyroidism, or edema due to hepatorenal disorders, drugs like corticosteroids over a prolonged period, androgens and oral hormone contraceptives tend to increase the woman's weight. Pathophysiology. Bone makes up 12% of the total body weight, muscles 35%, and body fat is 27%. The rest comes from the other organs and the blood and body fluid. Of the total fat, abdominal and visceral fat, waist circumference are linked to the diseases in the adult life. Since women tend to accumulate more fat over the abdomen than the hips as compared to men, women tend to suffer more obesity than the men. Leptin, 167 amino acid protein, is a hormone which is secreted by adipocytes in the fat that influences the hypothalamus regarding the appetite. Increased leptin increases the fat accumulation. Leptin secretion is also regulated by the insulin, which stimulates the leptin secretion. In pregnancy, some women develop insulin resistance and hyperinsulinemia, may responsible for the excessive weight gain through fat deposition and retention of the weight in postpartum. Clinical features are age. Pregnancy and menopause are linked to the obesity in women. Parity. Multiparous women tend to be more overweight than the less parous women. Family history, that is genetic. Many obese women are born overweight. Complications and sequences. Complications of obesity in adolescence. Precious puberty, PCOD, childbearing period, anovulator infertility, poor IVF outcome, pregnancy, Pregnancy-induced hypertension, insulin resistance, macrosomia, increased cesarean section delivery, increased anesthesia risk, increased surgery difficulty, increased postoperative sepsis, thromboembolism, scar hernia, postpartum depression. Cardiovascular diseases are myocardial infarction, diabetes, hypertension, stroke, arthritis, thromboembolism, hyperlipidemia, breast cancer, uterine cancer, ovarian cancer, colonic cancer, and stress incontinence. Management. Management comprises of prophylaxis treatment, that is the prevention and the treatment. Prophylaxis includes diet, exercise, pregnancy, management of the obesity, drugs and fetal obesity. Exercise, yoga, meditation and regular exercises help in reducing the weight. Rapid weight loss is not recommended, but 1 pound per week is safe. Walking for half an hour daily for 5 days is sufficient to maintain the weight. Diet. Proper balanced diet is essential step in maintaining the normal weight. A balanced diet should contain 60% of carbohydrate, 20% of protein, 15 to 20% of fat. Calorie intake of 1800 to 2000 daily is adequate, but also depends upon the body weight in kg. A diet containing fibers delay the absorption, lowers the glucose level. Carbohydrates should be mainly of low glycemic index. Animal proteins with amino acids are preferred. Pregnancy. Pre-pregnancy weight should be normal. Overweight women should be asked to reduce the weight before conception. Weight gain should be monitored regularly. Postpartum weight should be carefully monitored. Most women reduce the weight and return to pre-pregnancy weight by the end of third month of postpartum. Otherwise, diet control and exercises are recommended. Breastfeeding prevents the obesity in infants. Obese infants tend to remain obese throughout their life, exposing themselves to diabetes, hypertension, hyperlipidemia, and certain cancers. Management of obesity. Diet, exercise, drugs like lipase inhibitors, Orlistat, Remonents, Sibutramine, surgery, bariatric lipotomy, and gene therapy. Fetal obesity. Apart from changing lifestyle, diet, and exercise, it's important the cause of the adult obesity. Its sequelae is a fetal obesity, or what is also known as macrosomia. It is now realized that fetal macrosomia, due to a disorder in the maternal environment, causes the fat deposition in the newborn and infant. Metabolic disorder thus sets in and continues throughout the adolescence and in adulthood. Pregnancy adds to this metabolic disorder, and increasing weight gain during the pregnancy worsens this situation. Once obesity sets in, it is extremely difficult to shed it off. A sequelae of diseases follow, impairing the life and even causing early death. Prevention therefore lies in managing the pregnancy, controlling weight gain, and bring back the original pre-pregnancy weight in postpartum period. Controlling preconceptional weight and avoiding obesity, therefore pregnancy are also plays a very important role for the optimal outcome for the individual and long-term health benefit.